In a previous video, the Maxi Move patient lift was explained and demonstrated using a seated sling for moving and repositioning a patient. But the Maxi Move has multiple sling and harness options that can be used in different situations. One other useful option is the walking harness, and in this video we will explain application and basic use of this type of patient harness. The walking harness is able to provide the patient support and safety as they walk to regain their strength and mobility. If a patient falls, buckles, or collapses while walking or standing, the harness will catch and suspend the patient, safely avoiding injury. The walking harness allows patients safe space to practice walking independently or with an assistive device like a cane or walker. They can stand for extended periods of time to increase their strength or practice performing various activities of daily living. All you will need is the Maxi Move lift and the harness. The harness is adjustable and will fit most patients with a weight limit of 400 pounds. It consists of a girdle that wraps around the patient's lower torso, 2 leg straps that will extend under the patient's thighs to provide support if the patient collapses, and 2 large straps on top that will attach to the lift. To apply the harness, have the patient seated at the side of the bed. Begin by wrapping the girdle around the patient's waist. It connects with a series of 3 buckles that clip together in the front. You want the harness to be snug. Once the buckles are clasped, pull the straps to tighten the harness around the patient. Make it tight, but not so tight that it's uncomfortable. Next, take the large purple straps. The patient's arms need to go through the straps, and for now, drape the strap over the patient's shoulder. Then attach the leg straps. There is a padded section that you want to position under the patient's thigh. As you bring the strap under the patient's leg, you'll connect the clip to one of the 3 blue loops that extend down each side of the harness. Choosing the loop will depend on the patient's size. Ultimately, it doesn't matter too much which loop you use as long as for each side you choose the same one. But once you've clipped the strap onto the loop, pull the loose ends of the strap tight. These also need to be nice and tight, as tight as you can pull them without causing the harness to bunch together. Now the harness is on the patient, and your next step is to bring in the Maxi Move and attach the harness to the lift. Ensure the basic crossbar is attached to the lift. It is the appropriate attachment for use with this harness. Bring the lift close to the patient and lock the wheels. Lower the crossbar until you can easily clip the purple straps into the ends of the crossbar. The last step before you can use this device is to ensure that the left and right straps are adjusted equally. Look at the length of the strap that attaches to the top of the front of the harness. Make the distance from the harness to the strap adjustment piece equal. This ensures that the patient will be lifted evenly from both sides. If one strap is longer than the other, the patient will not be evenly supported by the lift. Now raise the lift. As soon as the patient feels the harness lifting them, ask them to try to push up from the bed and try to do as much as they can to stand on their own. Raise the lift until the patient is able to stand on their own. You don't want it to be so high that they aren't supporting their own weight. This is supposed to catch them if they fall, not suspend them above the floor. The crossbar should be above their head. If it's too low when the patient is standing, you will need to loosen those purple straps a bit to allow the crossbar to extend above the patient's head. With the patient standing, unlock the wheels and move the Maxi Move with the patient. As stated before, the patient may need this as they work to practice and improve their ability to ambulate independently, or they may be using a walker or other assistive devices. They may need the support as they perform various ADLs. The crossbar can swivel 360 degrees to allow the patient the freedom of movement needed for these various scenarios. If at any point they lose their balance or their strength gives out, the harness and Maxi Move will support the patient and prevent a fall or injury.